In the meantime, diabetes and hypertension are major public health concerns, which worsens the risk of cardiovascular disease. In a bid to contribute to the management
Felix
of these
Adegboye.
diseases, an APP developer is using artificial intelligence to help patients combine recipes. Olalekon Akinjoju has this report.
Adegboyega developed an application that employs the use of artificial intelligence to help people diagnosed with diabetes and hypertension. Named LD Plate, the web-based application guides patients on ways to combine recipes for the right kind of food that helps their condition.
So what it does is that it's going to take in your readings or your profile, your health status, and all those details. And then it can combine them and use it to generate a particular recipe for you. So now this is to guide you on knowing the right things to eat, the right ingredient to use for anything that you are preparing for yourself, especially as someone that is diabetic or hypertensive. You want to watch whatever you eat and the likes.
Diabetes and hypertension frequently occur together and worsen the risk of cardiovascular disease. The World Health Organization recognizes diabetes and hypertension as major public health concerns, emphasizing their interconnectedness and the need for integrated management strategies. According to medical experts, a healthy diet is crucial for managing both diseases.
You don't necessarily need to always visit someone that, oh, what do you think I can eat? I'm hypertensive, I'm diabetic, or whatever. So it's even going to show you step by step how you can prepare these things. So I leverage on already available AI models to do that, and I'm already a software engineer. I know how to plug this in, and I was able to do such.
Aside designing, developing, and maintaining software systems to create solutions for various needs, Felix also tutors young people interested in acquiring digital skills at a technology school in Osogbo, SQI College of ICT. The branch coordinator of the campus, Mercy Ajibade, says the school has been solving digital illiteracy and youth unemployment challenges through its programs. According to the National Information Technology Development Agency, Nigeria's digital literacy rate is at 50%, and the government has set ambitious goals to reach 95% digital literacy by 2030, with a milestone of 70% by 2027.
One is youth unemployment, and another one is digital illiteracy. In my role here, I've seen people who use, 6-7 years in the university, and when they come here, I ask them, do you have a laptop? What can you do on your laptop? And it's surprising to see that graduates do not know how to type on their laptop. They don't know how to write on Microsoft Word. They don't even know how to use Microsoft Excel. They don't even know how to create PowerPoint slides for presentation. So what we do in SQI is to bring that digital literacy to them. So when they come here, we ensure that they are digitally, literate. So we equip them with the needed skills. Now, once you join SQI, something is off the table, and that is unemployment. Because once you have a value to give, hunger will be far from you, right? So youth unemployment is also one thing that we are tackling, apart from digital, illiteracy problem that we have.
Felix's LD Plate application can help promote healthier eating habits among people diagnosed with diabetes and hypertension, leading to better long-term health outcomes. It is particularly useful in a country like Nigeria, where hypertension and diabetes are significant health concerns, with prevalence rates ranging from 20% to 38.1%. However, medical experts are urging caution on the use of AI to manage health challenges without proper regulatory controls.
Before anybody will be able to do something like that, there are guidelines that we follow: diagnosis of hypertension, the hyperlipidemia, the cholesterol is high, kidney disease, diabetes, and all of that. And there are guidelines to follow in terms of the management. Whoever is hypertensive, these and these are what the person is supposed to take. These are the much of exercise, things like that. Ditto for diabetes, ditto for kidney disease. So when somebody now design a software putting all of these acceptable guidelines into consideration, and then just leaving you with place to slot in your figures, your age, the weight, the height, the blood pressure, the systolic blood pressure, the diastolic blood pressure, the pulse rate, So things like that. Once you slot in, then the AI can then help you to be able to deduce some more information, okay, and be able to say, okay, this is what the management plan should be. But don't forget, there are regulatory bodies that must validate that whatever anybody has done is acceptable, okay, to an international standard before it can be put to use.
Despite its promise of combining technology and health for social good, Felix Adegboyega's LD plate application is not without limitations. Medical professionals say dietary needs can vary widely among patients based on individual health conditions, medications, and comorbidities, which an AI-based system may not fully account for. Access to the LD plate application may also be limited by factors such as internet availability, digital literacy, and the cost of smart devices, especially in underserved or rural communities. Olalekan Akindoju, Western Spring Television News.